Bones, muscles, and joints give the body shape, allow movement, and protect vital internal organs. Long bones form the upper and lower parts of each limb. Muscles, ligaments, and tendons attach to the bones, allowing for movement where the bones come together at joints. These bones are the most exposed to external forces and injury. There are 4 different types of injuries affecting bones, muscles, and joints. Strains are stretching or tearing injuries to muscles or tendons. Sprains are tearing injuries to ligaments that hold joints together. Dislocations are the separation of bone ends at a joint. And fractures are breaks in bones. Common signs of these types of injuries include swelling, pain, and discoloration.
I can help. Let's move you out here so nothing...
Distinguishing the exact type of injury is often difficult. It is best to treat everything as a possible fracture. The limb may appear deformed, and the person may guard it by holding it against his body. Unstable bones or joints can damage surrounding tissue. Encourage the person to not move or use the injured limb.
Just hold it as still as you possibly can.
If the injury seems serious or you are not sure, activate EMS.
To activate the emergency action plan and bring me the first aid kit, please.
Check to see if there is an open wound. Gently cut or tear away clothing to expose the injury site. Control any bleeding using a clean dressing and firm, continuous, direct pressure on the bleeding site. Do not push a bone back under the skin. Use padding in the gaps around it to provide a stable and comfortable spot for the limb to rest. If needed, place your hands above and below the injured area to help immobilize the limb. Local cooling can help decrease bleeding, swelling, and pain. It is best to not straighten an injured limb that is unnaturally angled. Leave the limb in the position found. If the limb becomes blue or extremely pale, circulation may be compromised by the injury. If you have not yet done so, activate EMS if this occurs. Splinting an injured limb can reduce pain and prevent further injury, especially when moving an injured person. In general, it is best to rely on EMS personnel to splint, as they have more extensive training, experience, and equipment. Comfort, calm, and reassure the person. Reassess the person and injury regularly until EMS personnel take over.